So, in terms of this article that I did find on secondary stroke prevention, one of the questions that we are asked to fulfill is what type of review did we find or is related to our article. And my article is related to a systematic review and meta-analysis used to evaluate the usefulness of secondary preventative approaches of transient ischemic attacks, or TIA, and strokes. As I shared earlier, this is my area of interest, and according to the American Heart and Stroke Association, as well as the Lawrence et al. 2015, stroke is the number 4 leading cause in the United States. It's, however, the 3rd leading cause of death in California, and worldwide is 15 million people die worldwide of stroke. However, it is the number 1 cause of disability. So, one minute you are living your normal life, you're nice and healthy. The next minute, unfortunately, you could have an ischemic or a hemorrhagic stroke, and your life has changed completely, now causing you to suffer from hemiparesis or weakness on one side of your body, and therefore limiting your abilities to be able to carry out your activities of daily living. And not only does it affect your life, and you can now become a fully dependent individual, but it now affects the lives of your loved ones, and therefore not only did you have a stroke, but your loved ones did so as well. According to Lawrence et al. 2015, they provide information saying that the recurrence related to stroke or TIA is that after you have a TIA, there is a 8.1% recurrence rate within the first 48 hours. So can you imagine that? You have a TIA and then you could have a stroke, which I've seen happen. And when it comes to having a stroke, there's a 39.2% recurrence rate that you will have another stroke within the 10 years. However, in my experience, I don't have evidence to present that data to you, but I've seen it happen where we have those frequent flyers that did not follow the physician's instructions with medication compliance, lifestyle changes, etc., and return to the hospital with another stroke or TIA. So the purpose of this study was conducted by Lawrence et al. 2015, as they state that guidelines recommend implementation of multimodal interventions to help prevent recurrent TIAs or strokes. And they undertook the systematic review to assess the effectiveness of behavioral secondary prevention interventions. So they used 14 databases, and some of the examples of these were strategical approaches implemented for data collection was done through Medline, Cochrane guidelines, randomized controlled trials. I believe there were 20 of those, and they had about 6,373 participants, and all included a variety of multimodal behavioral interventions. They also use AMED, ASSIA, SANAL. I mentioned Cochrane Center Registered of Controlled Trials, Cochrane DARE, DORIS, Embase, ERIC, Ethos, Health Management Information Consortium, Medline, PsycInfo, Social Services Abstracts, and ZTalk. And keywords that they use for their data collection were related to stroke, such as secondary prevention, specific lifestyle behaviors, smoking, physical inactivity, diet, alcohol, and perceived psychosocial stress. So the statistical level of confidence intervals was at confidence intervals of 95%. And as Poley and Beck state, confidence intervals provide information confirming how accurate or inaccurate the outcomes of the study and evidence really are. And they further add that confidence intervals prove how strong the evidence is, and it is imperative that nurse researchers include the confidence intervals data, as it provides value for interpreting study results and assessing their potential utility for nursing. Polite and Beck further add that clinical significance refers to the practical importance of research results. That is, whether the effects are genuine and palpable in the daily lives of patients or in the management of their health. So as we seem to understand, clinical significance at a 95% confidence interval is very important. And it was really interesting to read in the textbook by Polite and Beck that clinical significance has not received great attention in nursing research. However, they do stress that it is important that we include this information, as it will add more value to the data that we are presenting if, in fact, we want to make a change in the nursing profession and we want to prove that certain processes or interventions need to be implemented in order to prevent further medical problems, and in this case, it would be stroke.